PCOS just became PMOS. One letter changed, but what's behind that change exposes how incomplete your diagnosis, your treatment, and your understanding of your own body has been until now. A landmark study published in the Lancet, one of the most respected medical journals in the world, has officially renamed Polycystic Ovary Syndrome or PCOS to Polyendocrine Metabolic Ovarian Syndrome PMOS. This wasn't a random decision. It was the result of an 11-year global process involving over 20,000 patients, clinicians, researchers, and patient organizations from across the world. This is one of the biggest renamings in women's health history. Here's the problem with the old name. PCOS, Polycystic Ovary Syndrome, literally means many cysts on the ovaries. But here's what most women, and shockingly, many doctors don't realize. Most women with this condition don't actually have cysts. What appear on ultrasound are follicles, not cysts. The name was scientifically inaccurate from the beginning, and that one inaccuracy caused decades of damage. Women were dismissed by doctors if they didn't show cysts on their scan. Women blamed their ovaries when the real problem was their entire hormonal and metabolic system. Research funding was misdirected. Treatments were incomplete, and the stigma, particularly around weight, fertility, and appearance, was immense. So what does the new name actually tell us? Let's break it down. Polyendocrine, meaning multiple hormones are involved. It's not just one hormone, it's insulin, androgens, LH, FSH, a complex hormonal picture. Metabolic, meaning this condition deeply affects your metabolism, your weight, your blood sugar, your cardiovascular health, your mental health. Ovarian, yes, the ovaries are involved, but they are not the origin of the problem. They are often the victim of a much larger systemic dysfunction. Syndrome, a collection of features, not a single disease. As a gynecologist, I can tell you this new name finally reflects what we actually see in our patients. The World Health Organization estimates that 70% of women with this condition are currently undiagnosed. 70%. That is not a small gap. That is a systemic failure. And the name was a large part of why. When doctors are taught that this is primarily an ovarian condition with cysts, they miss the women who don't fit that picture. The lean woman with irregular periods and insulin resistance, the teenager with acne and anxiety, the woman in her 30s gaining unexplained weight. These women were, and still are, being sent home without answers. The rename forces medicine to look at the full picture. So practically, what changes for you? First, if you have been told you don't have PCOS because your scan was normal, please revisit that with your doctor. A normal ovarian scan does not rule out PMOS. Second, treatment should now address your hormones, your metabolism, your mental health, your skin, and your reproductive health together, not in isolation. Third, this condition now needs to be taken seriously as a long-term metabolic condition, the way diabetes or thyroid disease is. Not dismissed as a hormonal imbalance that will sort itself out. Here's what I want you to do after watching this. 1. If you have been diagnosed with PCOS, don't panic. Your diagnosis and your treatment plan remain valid. The condition hasn't changed, only the name and the understanding of it has. 2. Go back to your doctor and specifically ask, are my metabolic markers being monitored? Blood sugar, insulin, lipids, blood pressure, these matter as much as your reproductive health. 3. If you have been struggling with symptoms and never got a clear diagnosis, now is the time to push for a proper evaluation. You deserve a complete picture, not a partial one. I am a gynecologist with over 12 years of experience, and I created this channel because women deserve clear, honest, medically accurate information without the overwhelm. If this helped you, subscribe. Share this with a woman in your life who needs to hear it. And if you have questions, drop them in the comments. I read them. See you in the next one.